And the
each piece of that code has been tested. Yes or no?
I don't know.
Okay,
but I can tell you that security
testing, that's a much safer answer, trust me,
is an ongoing operation that as code is loaded, you need to retest over and over and over again. So whether it's pre-tested, I can't tell you.
You need to test the code. Have any end-to-end security tests been conducted since HealthCare.gov went live on October 1st, yes or no?
My understanding is there is continuous testing as the temporary authority to operate calls for.
Yes or no, has an end-to-end security test on HealthCare.gov went live, yes or no?
I will find out exactly what testing they're doing. I know they're doing simultaneous testing as new code is loaded.
Are there any end-to-end security tests run after every new piece of code is put in the system? I'm not talking about testing the code now. I'm talking about an end-to-end security test.
I can't tell you how
covers the cross of the boundaries.
But I will get you that information.
I can tell you they're not, and I'd be interested to hear why not. If you go to tab 2 quickly in your book, I'm going to read 3 things from...
I'm sorry, what book, sir?
You have a tab there. If you go to tab 2, right there, well, while you're looking, I'll read. It's dated September 27th, and it is to Marilyn Tavener. Let me eat just a couple of pieces here. There are inherent security risks with not having all code tested in a single environment. Finally, the system requires rapid development and release of hotfixes and patches, so it is not always available or stable during the duration of the testing. Secondly, the security contractor has not been able to test all of the security controls in one complete version of the system. And if you look in the first part, which is most troubling at all, it says, due to system readiness issues, the security control assessment was only partly completed. This constitutes a risk that must be accepted before the marketplace day 1 operations. And so let me tell you what you did. You allowed the system to go forward with no encryption on backup systems. They had no encryption on certain boundary crossings. You accepted a risk on behalf of every user of this computer that put their personal financial information at risk because you did not even have the most basic end-to-end test on security of this system. Amazon would never do this. ProFlowers would never do this. Kayak would never do this. This is completely an unacceptable level of security. And here's the scary part. We found out after the contractors last week that an end-to-end test hadn't been conducted on security, not functionality, because if it's not functioning, you know it's not secure. You are ongoing hot patches without end-to-end tests. The private contractors told us it would take a very thorough 2 months just for an integrated end-to-end security test that I'll tell you has not happened today. Why? Because you're constantly adding new code every night to protect the functionality of the system. You have exposed millions of Americans because you all, according to your memo, believed it was an acceptable risk. Don't you think you had the obligation to tell the American people that we're going to put you in this system, but you beware, your information is likely to be vulnerable? Would you commit today, Secretary, to shut down the system and give an end-to-end security test so that these Americans can have...
All right, serious new concerns about your privacy, and we are getting new reports that the feds are months behind schedule on data security concerning the new healthcare exchanges. It's just the latest in a long list of setbacks ahead of the rollout of the president's signature legislation. Fox Business Network's Rich Edson is in Washington with the latest. Hi, Rich.
Hey, Greg. A newly released report says the government is behind in testing its computer systems to ensure the Obamacare exchange is secure. In less than 2 months, healthcare exchanges go live. These are the online marketplaces where uninsured Americans will get health coverage. And this is under the president's health care law. An Inspector General report released this month says if there are additional delays in completing the security authorization package, the CMS CIO may not have a full assessment of system risks and security controls needed for the security authorization decision by the initial open enrollment period expected to begin on October 1st, 2013. The Centers for Medicare and Medicaid Services is designing this system. A spokesperson for CMS says the Inspector General's report uses information from 3 months ago. He says the government has made significant progress since then, and in a statement, The spokesperson says CMS has prioritized review of the audit reports and is confident the hub will be operationally secure and it will have an authority to operate prior to October 1st, 2013. One analyst says establishing this healthcare computer network is complicated.
There's a lot of wild cards in this. One is the fact that states are involved heavily in implementing these exchanges. A lot of states have been really gung-ho to set up their own exchanges. Some of them are having to face the fact that they're not able to get the IT systems up the way they thought they were going to. The federal government is stepping in to help them out and push them over the finish line and get things ready.
And as he put it, the government has some of the best computer geeks in Washington working on this. They've got less than 2 months to figure it out. Back to you.
Well, we're back now with one of the top stories from today's healthcare hearing. A leaked government memo revealing that just days before the Obamacare rollout, the website was deemed a high security risk, and yet they proceeded. Today, Republican Congressman Mike Rogers accused Secretary Sebelius of knowingly exposing Americans' most personal information. Watch.
You accepted a risk on behalf of every user of this computer that put their personal financial information at risk because you did not even have the most basic end-to-end test on security of this system. You have exposed millions of Americans because you all, according to your memo, believed it was an acceptable risk. Would you commit today, Secretary, to shut down the system and give an end-to-end security test so that these Americans can have their...
Joining me now, Monica Crowley, Fox News contributor and host of The Monica Crowley Show, and Bernard Whitman, who's a Democratic pollster and president and CEO of Whitman Insight Strategies. So this is a serious charge. I mean, this is basically that, forget the technicalities about the website, which eventually we assume they'll get fixed, that this personal security information of the people who've already gone on there is ready for the plucking by some hacker.
And the fact that they knew this ahead of time and decided to go forward with launching the website because they were so afraid of the political ramifications of not launching on October 1st, when they were willing to put all these Americans at risk, exposing them to theft, identity fraud, all kinds of criminal activity that they could now be exposed to because they inputted their information. The fact that they knew this and didn't do anything about it is a serious problem.
The anger you would feel, Bernard, you know, if you went on there, if you got kicked off your plan, as you were told you wouldn't, then you got kicked off. Then you went on the Obamacare exchange, HealthCare.gov. You were one of the ones who got on. You enter your information. Then you get hacked in your personal security. You get identity theft. Or, you know, I mean, it's how could they assume that risk?
There is no question that the rollout has been a complete disaster, but to suggest that people's personal security information, financial information was a risk is completely wrong. It's grandstanding, it's hyperbolizing, and it's absolutely factually inaccurate. That is not what the report said. Mike Rogers was grandstanding on the Sunday morning talk shows days before this memo was leaked. What this memo said was that there were potential risks. There is not a shred of evidence to suggest that anyone's personal information was, or ever would be potentially compromised. And unlike the data breaches that we've seen at TJ Maxx or AOL, where 100 million customers' information has been released, there is not any evidence to suggest that anyone's personal information was ever at risk.
Well, that it hasn't so far.
Right. This is just the beginning. And one of the other things that came out in the hearing today, Megan, was the fact that the Obamacare, HealthCare.gov, actually was hacked last week. So Lord knows where this personal information is right now. The problem for Team Obama is this, that if they want to attract people to come to the website and enroll in these exchanges, if they've been burned already once, if they can't get in, if their information has been exposed, if they've been compromised somehow, the idea of trying to get them back a second or third time to try out the website, to enroll, is going to be greatly reduced. Once people feel like they've been burned once or exposed or somehow compromised, they're not going to do it again.
Maybe we should talk to the hacker about how he got onto HealthCare.gov.
But that is
we
not
can learn
true.
some lessons
See,
about
that is another misstatement. This site was not hacked. Someone said there's a possibility of vulnerability that could be open, but the hacking actually did not occur. The problem that I have with this is that, unfortunately, the botched rollout has taken over the story, and unfortunately, people are not seeing the enormous benefits that Obamacare has. Don't forget, 80 million plus people have gotten free preventative care. 105 million people don't have lifetime or annual caps. 13 million people that did have couldn't get coverage because they had pre-existing conditions can now get coverage. Seniors have saved billions. That's the real story. That's being overshadowed. Why? Because of a botched rollout from this administration.
The problem is, if the website had gone perfectly, the story would still be that the president broke his promise and that those 13 million who got coverage because they got their pre-existing conditions covered are balanced out by the 14 million or so who are about to get canceled. Yeah, thanks to Obamacare. I mean, the whole point of this thing was to insure the people who lacked insurance, and we don't know how the numbers are going to net out.
The exact opposite is happening. So the insured are getting uninsured, right?
And then the federal taxpayers, are subsidizing them on policies for which they were happily paying by themselves before. Right. All right, in some cases anyway. Thank you, team.
You got it.
Thank you.